Good morning. Thank you for having me. I don't know if you looked at the bulletin, but I'll be talking about vision, not sleep. I'll be talking about innovations in vision. My name is Zubi Almuta. I'll be touching on screening, eye exams and diagnosis, as well as corrections and assistive technology. Now, unlike our past speaker, I'm actually not a doctor. How did I get into all of this? Well, I did want to become a doctor. I started my career in pre-med and I was in the US Army. But barely 2 years in, I became legally blind from macular degeneration. I'm sure most of you have heard about macular degeneration this morning. I had the juvenile kind called Stargardt. It just means that for an object 20 feet away, within 2 years, I have to walk up to it from 1 foot away. Clearly, one of my earlier choices went out of the window, so I chose engineering. Now, the particular thing about Stargardt, it's very similar to age-related macular degeneration, the dry kind. It stops when you hit your 2200, but my symptoms never match my diagnosis. So 300 eye care professionals later, and about a decade or plus later, we found that I actually had 3 genetic defects, the ABCA4 gene, so I have 3 forms of macular degeneration. Fancy having 3 viruses right in your computer.
Wow.
A lot of fun, right? So that's how I got into this. I became a user innovator. I decided to start tackling these problems. So today I'm a disability advocate at US Congress. The inventor of brain control for blind assistive technology. There's lots of problems with the technology that we use, so I decided to just figure out a way to use my brain to control it. So that's what ThinkEndZone is. And I'll be touching on that later. Now, where are the problem areas? Let's look at screening. If you look at screening, according to the American Optometric Association for children, there are about 20 million school-aged children today with an undiagnosed eye problem. This is largely due to the fact that the eye chart that we rely on is only 4% accurate. It misses 75% of the kids, and 60% of those it actually flagged never see an eye doctor. So it kind of doesn't really help us a lot. Now, for the adult, diabetic retinopathy is a big problem. That is blindness due to diabetes. You know, there are 30 million Americans today living with diabetes, and this is the #1 cause that leads them to blindness, as well as those who are 65 and older, the aging population. So that's for problems affecting the undiagnosed. Now let's look at those who have been diagnosed, like myself, people that rely on assistive technology. There are about 22 plus million Americans today with severe visual impairment, and we have to contend with a 70% unemployment rate. Now, why is that? Well, for whatever reason, blind assistive tech is not covered by health insurance, so you have to pay out of pocket. They're very expensive, several thousands of dollars, and they offer a poor user experience. So imagine that you're already working, you start losing your vision. How are you going to cope? This is primarily the reason why a lot of working age Americans prematurely end up in nursing homes, because they just don't know what to do and they can't keep up. Now, where are the innovations going on trying to tackle some of these problems? If you look at screening, a lot of companies have started deploying screening in mobile devices. There are so many of them: eye exams, smart optometry, etc. So they try to put screening in iOS apps, Android apps, etc. to make things easier to deploy them, to figure out when somebody's struggling to see. Other avenues like Peak Vision. Peak Vision, based out of Kenya, has found a way to produce a 3D printed accessory that fits over your smartphone for less than $100, and it can take a very good fundus photo of your eye. And with that fundus photo, they can tell if you have an eye problem. Now, Google is working on research in 2 great areas. Dr. Lily Peng and her team are leveraging fundus photos to be able to tell if somebody has cardiovascular problems. Imagine that, right? And then in another area, through their technology out of the United Kingdom called DeepMind AI, they're actually using eye scans to be able to tell if somebody has 50 different eye problems. So, like the doctor said, AI is going to play a very pivotal role in the future in trying to figure out both screening, eye exams, and eye diagnosis. Now, for Thinking Zoom, our vision is to create a world where vision impairment no longer steals dreams or kills careers. Our crazy idea is to try to leverage games and AI to figure out if kids struggle to see. And for those who are severely visually impaired, we actually have a prototype that we've brought out. Leverages brainwave readers and AI, and you can literally use the power of your brain to be able to zoom into things or activate text-to-speech. We feel that this will bring about a greater user experience for working-age Americans to be able to get a job, keep their job, and still stay independent. In closing, this is a view that we think will become more predominant in the future. In the last 2 years, Baylor Med in Houston has been able to screen 100,000 diabetics to screen them to see if they have diabetic retinopathy. Now, how are they able to screen 100,000 people in 2 years? Well, they've deployed smart cameras, cameras powered by AI. It takes your fundus photo, uploads it to the cloud that runs Iris software, and it gives an output. See that this person has diabetic retinopathy, or no, do this again in a year. So this is something that could become a more effective model to be able to attack this growing problem. So don't be surprised if you're able to see this model in your neighborhood Walgreens, CVS, or Walmart, or other centers where you can easily screen people for problems and attack the problem earlier to try to prevent blindness. So my name is Zubi Amonta. You can find me at thinkandzoom.com. Thank you.
Thank you, Zubi.